Hello, welcome to Healthful Conversations with SSM Health. I'm your host today, Julie Tristan, and we're talking about flu shots. So I have Dr. Farkas, an internal medicine physician with SSM Health Medical Group, here to tell me all about it. Hello, Dr. Farkas.
Hi, Julie. Thanks for having me.
All right, so let's just get into it. First question, why is it important to get the flu shot?
The flu is a very preventable disease, and we prevent the flu primarily by the vaccination. And the flu shot is very safe, very effective. And so it makes all the sense in the world to protect ourselves and our loved ones by getting the flu shot every year.
Question number 2, who should get the flu shot?
Everybody. So definitely for children, talk to the pediatricians because there is an age cutoff of 6 months above which we can get the flu shots. But in the world of adult medicine, everybody can get the flu shot. Even if you have egg allergies, we have different types of flu shots now that are available. So definitely contact your physician to see which one's the right choice for you, but we have one for everyone.
When should you get the flu shot?
So the CDC recommends being vaccinated by the end of October. Having said that, the flu shots come out in September. So anytime once they're available is a perfect time to get it. And even if you miss that end of October deadline, it's still a good time to get it as the year goes on, later in the year, later in the fall and winter, depending on what the flu numbers look like. It's very easy to get your flu shots. The pharmacies have it, doctors' offices have it. SSM, for example, offers a drive-through. So you just stick your arm out the window and get your flu shot and keep going. And we're offering those every Saturday.
I love that. You're making my life so easy. Just stick your arm out, get the flu shot, and go to Starbucks.
Exactly. And keep going. Exactly.
Loving it. Okay. And question number 4, what are your expectations for this coming flu season, given what we saw last season?
So that's a really good question. And I think you have a lot of people curious about the same thing. So last year was phenomenal in terms of flu. We pretty much didn't see any influenza at all, which goes to show how effective our masks are at preventing these sort of illnesses. As we saw when the masks came down, a lot of other viruses came back out as well. And so I think it's going to depend on how the masking looks. If we're all wearing masks, we expect the influenza rates will be low. If we're not masking, then it'll probably be similar to previous years.
And just like random question, if you got the COVID shot, can you also get the flu shot?
Yes, you can. So we are able to give them actually at the same time. So we no longer require that 2 week before, 2 week after distancing that we had in the past.
Good to know. Anything else you'd like to tell everybody about the flu shot?
Nope. I recommend it. I recommend it for you and your family members. It is very safe. It is very effective. Even if you are not high risk for getting very sick with the flu, it's still a pretty miserable disease to have. So the flu shot is a small price to pay to avoid laying in bed feeling very bad for several days.
Yeah, I feel like for me, I've learned how important getting the shot is. So I'm going to go to your drive-thru. I'll be like, here you go. And then I'm going to go on to Starbucks.
Exactly. Those drive-thrus are really, truly very revolutionary.
That's wonderful. Well, Dr. Farkas, internal medicine physician with SSM Health Medical Group, thanks so much for being here today.
Thank you. It was my pleasure.
This was another helpful conversation with SSM Health. You can find out more at ssmhealth.com.